Let me see who's out there. Anybody out there with me yet? Hello. Oh, she better not go to the bathroom. Hi, Ashley. Let me grab this puppy. Hi. Hi. I'm putting her out of the room. Hey, babe, here's the puppy. The puppy. Last thing I need is to be teaching and that puppy go to the bathroom. Hi, Diane. How are you? Hello, Allison and Ashley. Hello. You're here on time. Who are you? Tell me who you are. So, Ashley, you may have noticed that I am live streaming into the student community too on Facebook. So if one of you guys want to pin it in the FPE group and in the student community, last day before maternity leave. So you're sneaking again, girl. It's Erin. Hi, Erin. How are you? Erin, don't you think it's funny that I just moved your birth story over from the Facebook group and now we are using it again? I think it's so funny. All right, you guys ready to get started? I doubt this is there's probably not gonna be a lot of people on today. So I figured we'll just do it and then we'll leave it in the Facebook groups. That sound good, Ashley? Just leave it up. Yes, I know. Well, you know. Oh, my office is such a mess. Anyway, it is the last day of Fearless Birth Experience. How is that possible? I feel like we just met and planned. It's insane. So just so you guys know, I'm not going to teach you all the things about induction today. I'm going to teach you some things because you really need to be educated about all of this. And this is not going to be like a, you know, a long-winded thing, but I am going to go over some basics and we're going to talk more about your mindset and your decision process in this rather than the like, oh, what is induction and what is that and how do I do that and all that. We're not going there. I might briefly talk about some of those things, but for the most part today, what we're going to be talking about is induction right for me. So is it right for you? Because it's not right for everyone. Is it this horribly bad thing? No, not at all. Not at all. Hold on one second, you guys, because I just realized that, okay, so there we go. Let's make sure this is doing this right. I want to make sure it's streaming. Ashley, is it streaming in the student community? I hope so, because I'm not seeing it. Let's see. I want to make sure it's on. There we go. I think I have it everywhere now. Y'all know I'm bound to mess it up. Okay. All right. So again, we're not going to be talking about all the specifics of induction and going up over all the ways we induce you, the medications we use, the process. That's all in the birth classes. We're going to talk about, is it right for you? And how do you decide if it's right for you? So I'm going to briefly talk about what it is and some of the reasons. And then I'm going to talk about a little bit of specifics about people who might be kind of pushed into induction or who are more likely to hear about induction. But the first thing I want you guys to know, and I've been telling you guys all week, that I'm known as Crunchy with a side of medical. So I am not like induction is bad, inductions are horrible, induction is just the devil. I'm not, because there are really legit good reasons for a labor induction and for your labor to be induced. However, many times it's not necessarily the best decision for you. However, we will support you guys if you decide that it's best for you, because that does factor into my feelings about labor induction. So, and I know that I see someone has said, I've been told that if he doesn't come in week 38, I'll be induced in 39th week. I'm going to talk to you specifically in a minute because we're going to talk about that. And we're going to talk about different things that might be said. So, what is it? Why is it done? Medical versus elective. So, an induction is just that. We're going to get your labor started. And that is by us doing some sort of intervention to start your labor. Why is it done? So, there's many reasons why it's presented to a mom. There are medical reasons and there are elective reasons. So medically, maybe you have uncontrolled GDM. Now, I'm not going to say just because you have GDM, because I 100% do not believe that if you have GDM and it's controlled that you need to be induced. Another reason might be maybe your blood pressure is out of control. That can be a scary situation. So that might be a reason why your provider wants you to induce. So anytime that it is safer for baby to be outside of mom, whether it's a maternal reason or a fetal reason, then that would be a medical need for induction. Elective, on the other hand, is like maybe you're just tired of being pregnant, or maybe your provider's going out of town, or maybe you're moving. I was actually induced because we were moving from Florida to Tennessee. And my ex-husband had to start a job at a certain time. I didn't want to do it by myself. Should have, didn't want to do it by myself, but I decided to be induced. So that was my own personal reason. And I have a right to make that decision as long as it's a healthy decision for me and baby. And it was. So, but my provider back then, they did not want to induce. Since I've been a labor and delivery nurse for a very long time, and having my own children, I have seen the cycle of this induction wheel. And basically, it used to be nobody would induce, then everybody was inducing. Then we clamped down and they put up some guidelines to stop all the unnecessary inductions. And then doctors started coming up with all these reasons why induction is necessary. Namely, this stupid ARRIVE study, which is absolutely bonkers. It's not a good, thorough study, but they use it to make mamas feel that if they go past 39 weeks, they're putting themselves and their baby in danger. And of course, no mom is ever going to do that, but they're lying. It's not true. Very select few is that the case. The other thing they might say is your baby is too big. That's a new one. I'm telling you, before they clamped down and had more guidelines and rules and restrictions for these providers, when I was a newer labor nurse, I didn't hear about big babies like you do now. Big baby is a thing that came up after they put so many restrictions on them. Imagine this. Back when I first became a labor nurse, everybody was inducing. They induced all the time. And there was no restrictions. They just did what they want. We couldn't report them. A lot of labor and delivery nurses and charge nurses and hospitals were getting a little frustrated because we were getting more and more NICU inductions. Because imagine, if you will, the doctors are sending in a 37-weeker and she's off on her dates and the baby's really 35 weeks gestational age. They're going to go to the NICU. So we were having so many NICU inductions that restrictions were put in place. And the doctors had parameters they had to meet before they could even schedule an induction. They also had to specify, is it medical or elective? And they better damn well be able to prove it's medical. So once we started doing that, then suddenly there's all these other reasons they need to induce. The ARRIVE study comes out, which really helps them get away with it. All these different things, all these extra ultrasounds and these size, the growth measurements and blah, 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 blah. That was not a thing when I was pregnant, when I was younger. So that being said, again, If it's something you want and it's elective and it's healthy and it's safe, girl, go for it. You do what you want. You do you, and we will support you. That's something we do with our students. We support them, period. Okay, so the next thing we're going to talk about is should I? Okay, there are advantages to being induced. One, you can pick your baby's birth date, sort of, because you probably won't have, if it's your first baby, even if you're being induced on Wednesday, probably aren't going to have baby till Friday. But there are advantages to being able to decide that. Like I said, when we were moving and being able to have the baby and in time to be able to recover before I had to move. I moved when he was 9 days old, so I wasn't very recovered, but I was young and bounced back. So there also are disadvantages. Again, an advantage would be if it's healthier for baby to be outside of you, then hell yeah, thank you goodness that we have induction options. Because if it were back in the day and baby needed to come out, you would have had a C-section. So thank goodness for induction. Now, the disadvantage to the inductions are once we start intervening, it's a cascade effect, and we're going to have to do more and more interventions. The other disadvantage is that induced labor does not allow you to build up those natural endorphins and, those narcotics that fly, those natural narcotics that fly through your body. They don't have time to catch up sometimes. So it does feel worse in some sense. You also, you're stuck in the hospital during those days and hours when if you were going into labor on your own, you would be going to Target, going to get food, walking around, doing your own thing, watching TV and thinking, am I in labor? Is this the real thing? I don't know. So that being said, that can really mess with your mindset when you're at the hospital for hours and hours and hours before anything starts. You can really get worn out. So it's tiring. That's another disadvantage. The other disadvantage is it can interrupt the cycle of breastfeeding. It can cause you to have a higher risk for hemorrhage. And there's just been some studies that have shown it can affect like even your bonding with baby. Now, I've had 6 babies, 3 of which have been induced. So I'm not making anyone feel bad or anything because I had 3 inductions. I've been there, done that. So there are risks and benefits to both you and baby. Benefits would be more so if it's healthier for baby to come out of you. Okay, so now we're going to talk about decisions. So you do have to sit down and you have to write out these factors that you particularly need to consider. So I've had some moms who have chosen to be induced because they struggle with massive anxiety and just the unknown of waiting for labor to begin just caused them so much angst. And you know what? We 100% support her. This is why we have the labor bat signal. And if you haven't joined my birth classes, you need to, for sure, because nowhere else will you find the labor bat signal. And Ashley can tell you, we walk through those induction decisions and the options, because here's the thing. And Ashley, I wish I had Ashley on here with me today because she's our community manager and she's our postpartum doula in training and also pregnant with baby number 2, her number 2 LNM baby. And she was induced. But here's what she didn't do. She didn't say, oh, okay, so you want to induce me and what's your plan? And you're going to do this. And okay, doctor, I'll do that. No, she was like, wait a minute. I've learned a lot about induction and I would like to try blankety blank, blank, blank. And she led her induction. She got to have a Foley bulb. Her doctor didn't normally do that. But because she was educated and she knew her options, anybody out there want to message me, like send a chat. What do I say about options? What is my big thing about options? What's my mantra? And one of my team can say it. Y'all know I'm going to wait. I'm just hanging out here waiting. Yes. If you don't know the options, you don't have any. 100%. If you don't know your options, you don't have any. So I want you to really consider that. If you do not know your options, you don't have any. So this is same with induction. You need to know all the different options. And you know what? So what? If your doctor's doesn't normally do a Foley induction, so what? It's time to learn, doctor, or find another doctor or a nurse practitioner or a midwife in-house that can do it. So you need to be able to navigate the plan. Your plan is not out the window. You still have options. You also want to ask questions, like go with a list of questions. We have some stuff in your, if you join our birth class and you get your companion ebook, you have questions to ask. So ask those questions and find out, like, what are some different ways that we can approach this, and what are the alternatives, and what if I'm okay with you doing cervical ripener, but I'd really prefer to avoid having my water broken? Or what if I'm okay with this but not that? What can we do? What are the alternatives? What if I come in and you do cervical ripener, instead of going to Pitocin, I go to nipple stimulation, and your doctor's like, psh, whatever. No, well, just if you don't think it works, let me try. Let's see, because it does work. I've had many of VBAC moms that going nowhere, and we switch to nipple stim and it's on game time. Okay, so the reason I wrote induction police, and my girls know what this is because I say it all the time on our pregnancy hangouts, which we do weekly with our students. They are not going to send out the induction police to get you if you don't want to be induced. So if your doctor is pressuring you and you know in your gut that induction is not the right path for you, they are not going to force you. They cannot force you. They can only chart that they've recommended it, right? So what I recommend, if you do not want to be induced, you do not understand and that, or you do not agree, then let's make a compromise with your provider. You can say no, but you can also navigate it the right way where there's just not as much tension. Now, if you want to just be like, hell no, sorry, that's that, I'm all for it. But what you can do on the alternatives, so let's say you have GDM or you have hypertension, but it's controlled. And they're saying, oh, well, I induce all my patients who have GDM at 37 weeks or 38 weeks, or I won't let you go, blah, blah, blah. What you can say instead is, how about this? You can say to them, like, your concern is for baby's well-being, correct? Yes, I want to make sure baby's okay. Well, how about this? Instead of evicting the baby, how about I agree to come in for weekly or bi-weekly or whatever makes you feel comfortable. I come in and do a non-stress test, an NST, and a BPP, which is a biophysical profile, which tells us what? What does that tell us? That tells us the fetal well-being. Well, if their entire concern is about the baby being okay on the inside, then let's just show them that baby is. Now, let's say you agree to that. They agree to that because they know you're not going to go anywhere else, right? And you come in for one of your BPPs and your NSTs and baby doesn't pass. Guess what? You get induced because now they've shown baby's not doing well. So everybody is reassured. So I just want you to know that you do not have to get backed into a corner. Now, the power of the alternatives is there are alternatives. So I was telling some of the mamas last night, our birth courses are open for enrollment and you can use the coupon code to get $100 off. Well, part of that is if you are one of our students, you get your labor bat signal. And what we do with our labor bat signal is if we have a mama who is going to be induced or is high risk for induction, then we have her start her labor bat signal earlier than 37 weeks. So around 36 weeks, if she's knows she's going to be induced at 37, we'll have her started at 35. And we start doing some natural induction methods. Now, will it kickstart her labor? Probably not. But what it will do is get that cervix nice and ripe, get her body ripe, get the cervix soft, get it mushy and gushy and pliable and ready to open, ready for game time. So that's one of the things we do. Oops, sorry, guys. That's one of the things we do with our students to help them prep their body. And that's, one of the reasons, 100% one of the reasons why we have the labor bat signal, which I promise you, we are the only birth course that has something like this. because we want to help you navigate these twists and turns. And when you're 36 weeks and you go to the office thinking everything's kosher and, oh, when's my baby going to come? And I'm so excited for spontaneous labor. And then they tell you they want to induce you at 39 weeks. And you're like, what the living hell? You can send a labor bat signal, shine up your bat signal or what have you, and we will come to your rescue and help you navigate the confusion and the decisions, because maybe it is best for you. We don't know until we talk about it. So you have to know the benefits, you have to know the risks, you have to know the challenges of, waiting for natural labor, or spontaneous labor would be my other word, is difficult. It's difficult and it can be mind-boggling. And my girls can tell you, that's another good reason to have community, and why we've opened back up our student community is that we want all of you guys to have each other to be able to say, okay, all right, I'm doing it. I'm okay. I'm going to make it. Yes, I'm 40 weeks and 4 days, but I'm okay. And I've got this, and I'm going to stay on top of my mindset, because there are challenges when you decide to wait for spontaneous labor. And it's not kosher always. It's hard, and your body hurts, and you're tired, and you really, really, really want to meet this new baby. So I just want to acknowledge that, because I know a lot of people choose to be induced because they just don't want to do it anymore, and they really, really want to meet their baby. And that is so understandable. But I also want to remind you guys that not knowing the sex of your baby and waiting for labor are some of the two last remaining surprises in our, eventually we're probably going to be able to scan ourselves and tell exactly, like, just scan our watch and it'll be like, oh, you're having a boy, or, oh, labor is going to start in 3 days from now. So this is the last power of surprise that we have. And I feel like it's something we can revel in and enjoy and celebrate, instead of being, anxious about it. All right. Let's hear if you guys have any questions. Anybody have any specific questions? I want to keep this to a half hour. So hello. Anybody have a question? I know we don't have a ton of people on here, but if you have a question, let me know. And if you're ready to jump in the birth classes, let me know. I'll put up the QR code as well. I think that most of people who are here right now might actually be students. But if you haven't joined yet, go ahead and join. Say hello. Join our private community so we can say hi to you. Oops, my chat went away. Let me see. Where'd it go? What was the procedure you recommend? A BFP. It's called a BPP. So tell them that you would do a NST, non-stress test, and a biophysical profile. B as in like B as in boy, P as in Paul, P as in Paul. And what that does is an ultrasound that checks 5 different things and gives you a number on how baby's doing. And we explain, Adrian, if you're in the birth course, I have a whole section on testing during pregnancy that breaks everything down. Yes, whoever said options are key in induction is absolutely right. Let's see if I missed any questions. Yeah, if you are controlled GDM, you do not. We have a lot of moms who go almost to 42 weeks. If you're getting them twice a week, then that should be satisfying. That should be enough. If baby is passing twice a week, girl, do not worry about it. I would say if you're doing well, then push. And what we do is we take baby steps. So what we recommend to our students in the labor bat signal is to kind of push it forward a little. So let's say they want to induce you at 39 weeks. Okay, doctor, like I understand, but I prefer to come in for an NST and a BPP on 39 weeks. And then maybe we can talk about 39 and 5. Then when it's getting close, hey, I prefer to come in on 39 to 5. Let's talk about 40 and 1. Just boop, 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 push it out. Do you have any thoughts regarding Pitocin used on VBAC moms? Some doctors do it. I have a ton of students who have Pitocin, and there's absolutely no issues. Some doctors won't do anything on a VBAC mom. Doctors who are not willing to try anything, I would get a different doctor, is my suggestion, to be frank. If my regular blood pressure is around 115 to 80, what blood pressure for me would be a concern enough for induction? So, Sydney, I would say that if one or two high would not be a big deal. But if your bottom number starts getting over 90 consistently and it's trending up, then that might be a reason for an induction. But girl, we do not want to see that happen to you. Sydney's one of our students. Oh, yay. Did someone ask about using Pitocin and getting on the birth ball? Yes, you 100% can get out of bed. I walked the halls. So what we recommend, if you're being induced, ask for wireless monitoring. So you can call up to labor and delivery, call up to the hospital. Anything you want to know about your hospital, call up to the hospital, ask labor and delivery, ask to speak to the labor and delivery desk and ask them whatever you want to know. Do you have wireless? Do you have birth balls? Do you have peanut balls? Do you blah, 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 whatever it is. All right, couple more questions. We do not want it to trend up, Sydney. Let's keep it down. Is it really worth it to be induced just so you can be sure you'll have your OBGYN? Because I hear that they're only there in the moments the baby's crowning anyway, and the nurses, no, it is not worth. I am so stinking glad, whoever you are, tell me your name. I'm so glad you asked this question. This is a beautiful, powerful question to know. This is why I love our weekly hangouts, because this is the kind of stuff that comes out in the hangouts that I might not necessarily think about putting in the birth classes. No, it's not. You're totally 100% right. Your provider wants you to schedule it when they're there because that means they get paid. Whoever delivers your baby gets your whole kit and caboodle, all of it. Prenatal visits, all of it. Adrian. Okay. Yeah, I don't see you. You joined, right? Did you join or you were? I'm getting confused now. Are you my Adrian who was a student and is back again? I want to make sure. Got so many students. So 100% do not fall for that game. Don't fall for the game where they say, well, we want to go ahead and get you on the schedule because we are filling up. No, do not. Do not. Okay, new student. I knew I saw your name inside the community. Okay, so do not fall for because you want your doctor, because the truth is you may only see your doctor for about 15, 20 minutes. And that is not worth it, right? To change your entire birth story to have a provider who you're going to spend very little time with. Now, the other one that they use is saying, let's get you on the schedule because we're filling up. Here's the thing. If you go into spontaneous labor and you show up, the inductions are going to get sent home or not even get to come. You'll get booted. Now, spontaneous labor, you trump everyone. Unless someone is very high risk and being induced, they won't get sent home. So if you've been scheduled for an induction because your doctor tells you like you need to be induced, it's really important, it's healthier, and then you get bumped, you know your doctor's full of shit, right? Because you wouldn't get bumped if it were healthier for baby to be out. Yeah, Jenny said my doctor was there for delivery and repair. I can't tell you how many times I'm pushing with a first-time mom and baby is like crowning. They're like, the partner's like, are you going to call the doctor? And I'll be like, I'll call him right on time. A seasoned nurse knows exactly when to call, because here's what happens when a new nurse calls a doctor in and it's really not time and they have to spend unnecessary time at your bedside. They get pissed off and then they're going to go off on us at the nurse's station. Not all doctors, some don't mind, not midwives, but providers do not want to be there. And they want to gown up and catch the baby. That's it. So do not plan your birth around that person. Now, if your partner was traveling and was only home for a week, that's a good reason to be induced, but not for your provider. Does that make sense? Hopefully that helped. All right, you guys, I am going to hop off. I am so excited. We have so many new students, so excited to get to know them. And you guys are joining at such a beautiful time because I feel like the stars are aligned and some huge things are going to be happening inside of the Labor Nurse Mama community. So welcome, welcome, welcome. We're so glad you're here. Again, if you're watching this and you haven't joined, the coupon code is in the notes. You can join for $100 off and join our community. And when you're ready, if you're over 35 weeks, you're ready. But when you're ready, you need to add on the virtual services, which are $39 a month or $197 for a year. You cannot beat $197 for a year to have access to a veteran high-risk nurse, 2 doulas, a postpartum doula, a baby care specialist, all the things we have in our community. So, and labor bat signal, that's worth $100 a month or more. Most virtual doulas charge a ton. Look up virtual doula services. You guys will see what I'm talking about. Okay, you guys, have a beautiful day. I will see you guys at 6. I'm teaching my coping tools tonight. I can't wait. We love this class. And then afterwards, all my students and all my VIP mamas and all my virtual members are invited to a hangout at 7:30. All right, you guys, I'll see you guys later. Thank you to my team. Thank you. Thank you.